a umbilical lines. So how many vessels do you have in your umbilical cord? 3. And what are they? 2 arteries and 1 vein. Yep. So you can put in, so in our newborns, if they need resuscitation in the delivery room, we'll put in what we call an emergency UVC, so umbilical venous catheter. And this just goes in, it's similar to, it's like, it's more, I don't know, kind of like this, but it's a 5 French, so it's about this size. We tie off the umbilical cord with something that looks like a shoestring, because we want to be able to get that off eventually. And then we can thread the catheter until we get blood return. So once you get blood return, which usually is only like 3-ish centimeters, then we can give epi through that if we need to give epi, if we need to add blood. So like when we were talking about the Apgar score, the baby's really pale because they, for some reason, have lost blood volume and we need to give blood. We can give blood through that emergently. And then once they get up to the NICU, we can put in actual lines that would stay in. So they can have an arterial line, just like adults have, like they either can have femoral or jugular arterial lines. We can monitor blood pressures through that as well, give fluids through that. And then, but we don't give any meds or anything through our UAC, umbilical arterial catheter. But our UVC, venous catheters, we can give everything through that we need to. So a lot of times these babies will have fluids going, they'll have meds going, just kind of depends on what they all need. But it's a really easy way to, and you don't have to poke them. So like our really itty bitty preemies, you don't want to stimulate them any more than you have to, where sticking them with an IV is going to tick them off and make them scream, which is going to increase their pressure to their brain. So a lot of times we'll put lines in, and then they just suture them in place. So it's not like you can just tape them down. They suture them to wherever they're supposed to be. We check them to make sure they're in the appropriate placement with X-ray. Lots of different ways you can get lines on kids.
Is there only one size U-bag?
No, there's multiple different size U-bags. Oh, you can use, these are the same. No, this one's bigger. So depending on the size of the kid, you can use a bigger bag or a smaller. We have even some preemie ones that are like half the size of this. They're just like itty bitty tiny things. But depending on what kind of sample you need too, that cotton ball might suck up enough urine, that'll not be blood, urine that you can squeeze it into a urine cup. So if you just need, like for instance, we do a lot of urine sodiums, so we check their sodium level of their urine, which is weird and it has to do with their food they're getting and everything. But it doesn't have to be clean per se. We're not looking for bacteria. So we'll just stick a cotton ball right on the edge there and then just squeeze it out into a specimen cup. Either works to get what you need. But obviously it has to be a really clean sample. If you're worried about, urinary tract infection, you can't exactly just like start squeezing urine out with gloves, unless I guess if it was absolutely necessary and you had sterile gloves, potentially, but I wouldn't bank on it. Any other questions? No? You're ready to go to sin? No? What time do we have? 07. Okay, a couple minutes. I'm going to do some questions. Just a couple. Let's see if I can find one that's... A nurse in the emergency department admits a 2-year-old child with fever of 103, inspiratory stridor, respiratory rate of 40, and drooling. What nursing measure is warranted? Actually, I just had kids with this. Access the throat using a tongue blade. Complete a head-to-toe assessment. Lay the child flat on the exam table. Notify the ED physician immediately. Yeah. What are we worried about? From? Usually asthma. Don't usually have fever with asthma. Epiglottitis. So their epiglottis is inflamed. Actually, just transported a kid with this a couple weeks ago. Basically, that kid needs intubated like right now, because if that epiglottis swells completely, there's no way of getting an airway down. The kid's just kind of out of luck. Scary. Very scary. Typically, they present with croup-like symptoms, so the stridor, the increased respiratory rate, drooling is another huge classic sign. If they're not like a kid that's teething, but they're drooling, big sign. Oh, where was the one back here? There was a good one here. Which information should the nurse include when providing home care instructions for the parent of a 3-year-old with otitis media? Ask your physician for a prescription antihistamine if fluid remains present after 2 weeks. Use a pillow at bedtime to decrease comfort. Take the antibiotic until the pain subsides, or use an over-the-counter decongestant to hasten absorption of fluid. What's otitis media? Ear infection. Yep. So if they've got a bunch of fluid and we want it to drain, what are we going to do? Elevate with a pillow. Yep.
So to decrease comfort though,
The
doesn't it?
antibiotic information to providing home care instructions for the parent. So it's kind of instructed. Take the antibiotic until when? Until it's done. Yep. You got it. The nurse is advising parents of an infant with congestive heart failure, or CHF, about feeding techniques. What information should be included? Allow the infant to feed for up to 1 hour to accommodate the less effective suck in CHF. Increase the amount of formula at each feeding for longer rest periods. Position the infant at a 20-degree angle for feedings to avoid abdominal pressure during feeding, or 24 calories per ounce formula over 20 cal. So CHF in kiddos, they typically have more or less energy. Less energy. They work a lot harder. Why is that? Yep, we got that fluid usually in there. So do we want to increase the amount of formula at each feeding? No, we want to decrease it. So small feedings more frequently, typically they'll do. Position the infant at a 20-degree angle for feedings to avoid abdominal pressure. Abdominal pressure is not going to really affect that. I mean, you could feed them at an angle, depending to help their energy. But more calories. The 24 calories formula is preferred over 20 calorie. Breast milk, does anybody know how many calories per ounce breast milk is? 19. So breast milk is 19. Formula is usually 19. Sometimes they'll say 20 cal per fluid ounce. But then we can do more calories. So like NeoSure, for instance, is a formula that's got more calories. So more calories, less volume, shorter feedings. What's the most effective method for at-home administration of an inhaled medication for a 2-year-old with asthma? Dry powder inhaler meter dose inhaler, nebulizer with a mouthpiece, or spacer with a mask.
Spacer.
Yep, spacer with a mask. Child with a barky, seal-like cough is most likely to have which condition? Bronchiolitis, croup, pneumonia, or TB?
Group.
Croup. Sound like barking seals. It's totally true. In infants, grunting respirations may herald the onset of which condition? Asthma, laryngotracheal bronchitis, respiratory failure, or sleep apnea? Respiratory failure. Yep, a grunting kid is never good, especially a newborn.
My kid grunted, but they weren't worried about it.
Yeah, so if they are tachypnic and grunting, we don't let that, like, oh, they're singing, isn't that cute? No, it's not cute. And the newborn, it's not cute. But if sometimes they're what we call comfortably tachypnic, which newborn nursery nurses hate when NICU nurses say that. But if they're comfortable and they grunt for a little while, short amount of time, but their oxygen saturations are beautiful. So if they're 99% and they're breathing in the 40s, but they're grunting a little bit and they're only a half hour old, put them skin to skin, let them grunt. Now, if they're 4 hours old and they're grunting, that's a problem. Then we don't let it go any further.
Why do they grunt?
Yeah, why do they grunt?
Do normal babies grunt?
Not
does that
like
tell
not
you?
like
She
pooping
inhaled
grunt.
meconium. She inhaled
Yep.
the fluid.
Yep.
Or even think of an adult. If an adult is grunting,
Usually it's just because they've got fluid of some kind in there. They're having a hard time opening up their airway. So it's taking more effort to keep everything open rather than open and close, open and close, open and close.
they're having to work hard at it. For some reason, something's going on, and they
Working a
are
little
in
harder.
distress or working harder. They're using more energy to try to breathe.
If you have a toddler that's grunting, like, run. Go fast.
Yep.
All right, what time is it?
We good?
Oh, it's time.